Welcome to the Deep Dive. We take your sources, pull out the core insights, and give you the knowledge you need, but, without all the extra noise.
Exactly. No information overload here.
So today we're tackling women's intimate health. It's a big topic, often complex, and we're using She-ology, the definitive guide to women's intimate health, period, by Dr. Sheri A. Ross as our guide.
Right. And Dr. Ross, she's an OBGYN, been doing this for over 20 years, so a ton of experience.
Yeah.
Her whole mission, she says, is about empowering women, starting what she calls a vagina revolution. Basically, getting people to talk openly, understand more, and ditch the stigma.
A vagina revolution. I like that. It definitely signals a need for change. I mean, just looking at the contents page, you've got everything from the healthy V, tween V, all the way to mature V, even sporty V.
It shows how much ground she covers.
It really does. It makes you realize intimate health isn't just one thing. It, changes throughout your life.
Exactly. And that's why this deep dive is hopefully really valuable for you listening. Our job is to pull out the key stuff, the practical bits from Dr. Ross's experience. Maybe some surprising facts, too.
The goal is you walk away informed, maybe learn something unexpected, but definitely not feeling buried in information.
Precisely.
Okay, let's dive in. One thing that jumped out at me right away in the book is how much Dr. Ross talks about communication. Or, well, the lack of it sometimes between women and their doctors.
Yeah.
She even tells that story about doing cocktail party consultations because women ask her things that they wouldn't ask their own GYNs. What's that about?
Well, it really points to a gap, doesn't it?
Yeah.
Dr. Ross feels that even in a doctor's office, women often don't feel comfortable enough or maybe don't have that connection to bring up really personal stuff.
Right.
And think about that Duke University study she mentions. A third of teenagers don't have questions about sex and checkups. And when they do, the conversation lasts, on average, 36 seconds.
36 seconds. Wow, for topics this important, that's not much time at all.
Not nearly enough. And what impact does that have down the line?
Yeah. But here's another angle she brings up that I thought was really powerful. She calls gynecologists potential gatekeepers for the mental health of young women patients. And she tells the story about identifying a patient who was self-harming during just a regular exam. That really broadens the picture of what these visits can be, doesn't it?
It absolutely does. Adolescence is such a key time, and OBGYNs can be this crucial touch point. But for that to work, for young women to feel safe sharing really sensitive things, sex, mental health, whatever it is, confidentiality is just non-negotiable. Dr. Ross really hammers this home, that trust is everything for asking the hard questions.
Makes total sense. Okay, so the book breaks things down by life stages, which feels pretty logical. Let's start with adolescence. Dr. Ross talks about that shift from the pediatrician to the gynecologist. Sounds like it can bring up some anxiety for teens and moms, especially around birth control.
Yeah, there's often this worry that just talking about contraception means you're encouraging sex.
Right.
Dr. Ross tries to smooth that over, normalize it. And she gets practical, too, talking about tampons, like Sabrina's story, having trouble using them because of a septate hymen. It shows why even a basic external exam is important.
And it's not just tampons anymore, right? She mentions menstrual cups, like the Diva cup. What's the appeal there? Seems like people are talking about them more.
Definitely. They offer, a more natural feel for some, less waste, which is a big plus for many, and potentially cost savings. She does mention sizing, though, it's different if you've given birth, practical stuff.
Okay.
And crucially for this age group, she strongly recommends the HPV vaccine. For girls and boys around 11 or 12, it's such a key preventative step against a really common virus. It really reduces HPV-related problems down the road.
Good point. Okay, living into the reproductive years. Contraception is obviously a big focus. The pill is still common, but it sounds like things are shifting, especially with IUDs.
Yeah, well, Dr. Ross touches on the side effects the pill can have for some people. And there's definitely a bigger push now for what they call LRRCs, long-acting reversible contraception.
LARCs, right?
Yeah, like IUDs and implants. Big medical groups like ACOG are actually recommending them as a first-line choice now. They're super effective, safe, and you don't have to think about them every day.
That makes sense. Another issue in these years, polycystic ovary syndrome, PCOS. Sounds like it shows up in different ways.
It can, yeah. Dr. Ross lists the main signs like irregular periods, maybe acne, extra hair growth where you don't want it. But importantly, she also talks about the long-term risks. Things like a higher chance of diabetes, heart issues, even endometrial cancer later on. So getting diagnosed, which usually involves looking at symptoms, history, maybe blood tests or an ultrasound, is really key to managing it properly.
Right, managing symptoms and those future risks.
Exactly.
Fertility is another huge topic, and Dr. Ross is pretty upfront about age. She mentions egg quality declining after 40. That's a tough reality. What does she suggest people can do?
Well, she talks about egg freezing. It's a way to sort of press pause, preserve fertility potential. Ideally, she suggests doing it in your early to mid-30s.
Okay.
The success rates using those frozen eggs later are much better if you freeze them before, say, 38, compared to waiting until your 40s. So it's something to think about if you see kids further down the road.
And if fertility challenges do come up later, she covers things like IVF. She even shares her own story there. And donor eggs, surrogacy, sharing stories like Wendy's or Kimberly Quaid's. Lots of options.
Yeah, these are really important ways people build families now. Sharing those stories makes it real. She does note, though, that surrogacy especially can be really expensive. That's a major factor.
For sure. Okay, so after childbirth, the postpartum period, Dr. Ross has a whole chapter on this. Sounds like a time of major adjustment, physically and emotionally.
Oh, absolutely. Physically, you've got huge hormone shifts, which can cause things like night sweats as your body readjusts.
Yeah.
And emotionally, she talks a lot about postpartum depression, PPD, and also the baby blues. It's really common. The key is knowing the difference. Baby blues are temporary. PPD is more serious but treatable. And she mentions postpartum psychosis too, which is rare but very serious.
And physical discomforts too, like pain during sex, dyspareunia.
Yes, definitely. That's often linked to vaginal dryness, especially if you're breastfeeding, because estrogen levels are lower.
So what helps?
Practical things, like using good lubricants. Sometimes doctors prescribe topical estrogen cream, and she also really emphasizes Kegel exercises.
Ah, Kegels, always Kegel.
Always Kegels. But seriously, strengthening those pelvic floor muscles after birth helps with bladder control, pelvic pressure, and can even improve sexual feeling later on.
Good to know.
Yeah.
Okay, then comes the transition into perimenopause and menopause, another big shift. What are the common things women experience then?
It's definitely a time of change. Dr. Ross describes typical perimenopause symptoms, periods getting irregular, hot flashes kicking in, mood swings, maybe lower libido, even brain fog or memory issues.
Sounds fun.
Huh. Yeah, well, she stresses seeing a doctor to rule out other causes first. But for managing things like hot flashes, there are options. Lifestyle changes, some herbal remedies, acupuncture, even low-dose antidepressants can help some women.
And what about low libido? That comes up a lot. And that term, vulvovaginal atrophy, VVA.
Right. Low libido is common. She mentions testosterone therapy as a possibility sometimes, plus lubricants are key. And VVA, yeah, that's basically thinning and drying of vaginal tissues due to less estrogen. It causes dryness, pain with sex, sometimes urinary issues.
So treatments for VVA.
There are quite a few now. Over-the-counter moisturizers like coconut oil can help. Then there's localized estrogen creams, rings, tablets, prescription pills like Osphena, even laser treatments like the Mona Lisa Touch. So definitely things you can do.
That's encouraging. And she tackles that fear some women have about the vagina closing up.
She does. She debunks that myth and explains how vaginal dilators can actually help maintain elasticity if needed.
Okay. Hormone replacement therapy, HRT. Always a big topic with menopause. What's Dr. Ross's take? Sounds balanced.
It is. She points out HRT, especially estrogen, works really well for symptoms like hot flashes, and it might protect against osteoporosis and heart disease. It started around the time of menopause.
But there are risks.
There are potential risks, yes. A slightly higher risk of blood clots and maybe breast cancer with certain types of combined HRT. It's a conversation to have with your doctor. Importantly, she also clears up myths like HRT causing weight gain. Not necessarily true, and the idea that bioidentical hormones are automatically safer.
Good clarifications. Let's switch gears to STIs, sexually transmitted infections. Dr. Ross starts that chapter emphasizing healthcare rights for lesbian and bisexual women, and why doctors need to ask directly about sexual orientation. Why is that direct question so important?
It's absolutely crucial for giving the right care. If a doctor doesn't know, they might miss screening for relevant STIs or not give the right preventative advice. It's about inclusive, effective healthcare.
Makes sense.
Then she goes through the common STIs. HPV, super common, linked to cancers, why vaccination is so key for a wide age range, and clears up some myths about how it spreads. Then chlamydia and gonorrhea bacterial, thankfully treatable with antibiotics, but can really impact fertility if you don't catch them. Syphilis, also bacterial, has stages. Herpes, HSV1, HSV2, how it spreads, no cure but manageable with meds. And trichomoniasis, or trich parasitic but curable, and treating partners is essential.
So a lot to be aware of. Which leads back to safe sex practices.
Absolutely. Dr. Ross really stresses condoms, dental dams, consistent use is key, and open communication with partners always.
Definitely. Okay, beyond STIs, just general vaginal health and hygiene, she recommends simple washing.
Yeah, daily washing of the outside parts with just mild, non-fragrant soap is enough. And she strongly advises against douching.
Okay, why no douching? People still sell those products.
They do, but douching messes up the natural balance of bacteria and the pH level inside the vagina. That can actually increase the risk of irritation and infections like bacterial vaginosis or BV.
Oh, okay.
She talks about BV that often has a fishy odor and discharge, and yeast infections, which cause itching and white discharge. They're different, need different treatments. The vagina is pretty good at cleaning itself internally.
Good to know. I found the chapter on the perfect V and body image really interesting, especially now with social media. Sounds like there's a lot of pressure.
Huge pressure. Dr. Ross really pushes back against these unrealistic ideals, often from porn or edited images. She emphasizes that there's a massive range of what's normal for labia, clitoris size, everything.
So the perfect vagina is just a healthy one.
Exactly. Medically normal, not some aesthetic ideal. She even gives the typical size range for the clitoris and makes the point that size has zero to do with pleasure. And she warns against getting cosmetic surgery for the wrong reasons, just based on these pressures.
Right. Okay, shifting to sexual function and pleasure. Dr. Ross says good sex is learned and needs communication.
Yes, absolutely. It's not always just automatic. Open talk with a partner is key. And she reminds us the clitoris is the main center for female pleasure. Seems basic, but maybe not always focused on.
True. What else does she cover?
She discusses orgasmic disorder, difficulty reaching orgasm, and potential causes, physical or psychological. Also, hypoactive sexual desire disorder, which is persistent low libido.
What causes low libido?
Could be many things, she notes. Stress, relationship problems, medical issues, medications. Treatments might involve addressing the root cause, maybe testosterone therapy in some cases, devices like the ERSS, even just vibrators for exploration.
Interesting. She also mentions ejaculatory orgasms and faking orgasms.
Ejaculatory orgasm happens for some women. And yeah,
It's like divorce also come up. Navigating dating again, talking about sexual history, STIs.
right. She points out that often after divorce, the focus is everywhere but on your own self-care, including intimate health. So it's a reminder about those important conversations when starting new relationships.
Yeah.
And also potential physical changes, like maybe needing lubricants more,
Yeah.
especially post-menopause.
Yeah.
She even makes an interesting point about how medications like Viagra work for men, but if their partner is experiencing postmenopausal dryness, intercourse might still be uncomfortable for her. It highlights different physical realities.
Good point. The book gets really specific with chapters like the sporty V, cycling, spinning, horseback riding, causing issues.
Yeah, who knew? Pressure, chafing, maybe more risk of infections from sweat and friction.
So what helps?
Simple things, really. Chamois cream for cyclists, good hygiene like showering right after, letting things air dry, maybe special bike seats or padded shorts. She even mentions potential issues from water skiing or, believe it or not, sex in the ocean. Just practical tips to avoid irritation.
Okay. Then there's the adventurous V-swinging polyamory. Sounds like communication and safety are paramount there, too.
Absolutely. She approaches these non-judgmentally, just stressing that honesty, respect, and always using condoms are crucial for everyone's health in those kinds of relationships. She also touches on fetishes briefly and using sex toys safely.
And the tasty V, I have to ask about the pineapple myth.
Yes, she tackles that. Basically, no, eating pineapple isn't going to dramatically change how you taste. Everyone's chemistry is different. Variations are normal. The main point, again, don't douche trying to change things. Just good general hygiene.
Got it. No pineapple magic. Finally, the pink V chapter, cancer and intimate health, a really important connection.
Very important. She acknowledges the emotional weight of a cancer diagnosis, reminds us about routine screenings like mammograms. But she also focuses on sexual problems that treatments can cause loss of desire, dryness, pain, body image changes. These are often overlooked side effects. She also talks about things like the BRCA gene, preventative surgeries like mastectomies or removing ovaries, sharing personal stories again. And she points to resources like Right Action for Women for support.
Wow. Okay, we've covered a lot of ground thanks to Dr. Ross's book.
Yeah.
If you had to boil it down, what's the big takeaway message for our listener from this deep dive into She-ology?
I think the core message is that your intimate health is incredibly important. It's diverse, and it changes throughout your life. It really demands open conversation with doctors, with partners, plus self-awareness, and good, accurate information.
Yeah.
Dr. Ross really empowers women to take charge, to ask questions, and understand that normal covers a very wide range.
Absolutely. And ditching that idea of a perfect vagina based on looks, healthy is what matters, and everyone's different. Feeling okay to talk about concerns with your doctor seems key.
Exactly. It's about empowerment and knowledge. So maybe a final thought for you to consider. How much do you think societal awkwardness, or just not talking openly, still gets in the way of understanding and taking care of women's intimate health? And maybe what's just one small thing you could do, even just in how you think about it, or a conversation you have to help make things a little more open and informed?